I'm passionate about research because of the opportunities it brings for my populations in Blackpool who are so in need and so deserving of new treatments. And it's a way to bring all of those fantastic new innovative treatments to a population that's otherwise lacking in access to them. I think for commercial sponsors, the beauty of primary care is vast. So we have access to a breadth of specialties. We're not pigeonholed into a single clinical specialty. So things that you might traditionally think of as better suited in hospitals, diabetes, asthma, COPD, vaccines, these are all things that GPs do day in, day out. We know our patients, we manage their care for all year round, from kind of cradle to grave. And so we have access to all that information, and we look after such a wide range of diseases. And particularly for clinical trials, you don't necessarily want the most complex, most difficult patients. You want the relatively well-controlled diabetics to go into those studies. So I think what makes primary care different to secondary care is that we're often the first point of contact for those patients. So if you're looking for newly diagnosed diabetics, newly diagnosed hypertensives, we're the ones that find them and see them before they get so complicated that they need to be seen in a hospital setting where they then might fall into exclusion criteria. So I think having it out in the community, it just allows for a bigger pool of patients normally for studies. I think the biggest unique selling point of primary care is not one single thing. I think we have the ability to do thorough feasibilities, quick startups. We don't have all the huge different departments that you have to go through in a secondary care setting. We can turn things around within days to weeks. We often will exceed targets very frequently. I think our retention figures speak for themselves. We have decades of relationships before the studies start, so that will often continue right to the end of the study, and that special relationship is maintained throughout a clinical trial. I think we really enter into a partnership with sponsors to go through the study in a way that I don't think secondary care can sometimes do, that just to the nature of a huge secondary care hospital. I think the other benefits of being in a primary care setting are just kind of the physicality, being in a smaller building with smaller teams. It allows for better oversight. Everybody knows from day to day what everybody's doing. It's very easy to disseminate information quickly, to train staff very quickly. It just allows for a kind of a more cohesive running of the clinical trials, and I think sponsors recognise that. And so I just think, it's a real untapped resource for clinical research in primary care.